ஸ்ட்ரோக்னா ஹார்ட் அட்டாக், நெஞ்சு வலி. இது கிடையாது. ஒரு ஸ்ட்ரோக்னா அது வந்து ஒரு பிரெயின் அட்டாக். அண்ட் இந்த பிரெயின் அட்டாக்ல ரெண்டு டைப் ஆஃப் பிரெயின் அட்டாக் உண்டு. ஒன்று வந்து the blood vessel to the brain gets blocked. அது ஒன்று. ரெண்டாவது ஒரு ப்ளீடிங் இருக்கு. ஸோ ரெண்டுமே ஸ்ட்ரோக் தான். ஸோ ஸ்ட்ரோக் மீன்ஸ் பிரெயின் அட்டாக். நான் இப்போ பிரெயின் அட்டாக் வந்து இஸ் இட் வெரி காமன், ரொம்ப ரேர், கேள்விப்பட்டதே கிடையாது, அப்படிதான் எல்லாரும் ஒரு மாதிரி நினைப்பாங்க. பட் ஆக்சுவலி பார்த்தாக்க it is very, very, very common, as common as a heart attack. World statistics are there. We are not getting the slides. So world statistics are there to say how common a stroke is, a brain attack is. Every 40 seconds somebody suffers a stroke. Every 40 seconds. 1.1 million people are living with after effects of stroke, and there is 12.2 million new strokes every year in the world. And World Stroke Organization enna sollirukuna, 1 in 4 of anybody will suffer a stroke at some point of time in their life, which means that 4 பேர் இருந்தாக்க அதுல ஒருத்தர் வந்து definitely they will have a stroke at some point of time. That's how common it is. And that is why we must know that stroke exists, and that we must spread awareness that what is stroke, how do we recognize stroke, and how do we prevent stroke. After that, how do we treat stroke? It is very important to recognize stroke. The recognizing stroke comes with the BFAST, BEFAST, balance, eyes, face, arms or leg, speech. In the 5 விஷயத்துல ஏதாவது any one of these has a problem, it is immediately time to call the hospital. Why is it time to call the hospital? Because every second the brain does not receive proper blood supply, 30,000 blood cells die. 30,000 brain cells die every second. And in a minute, 2 million brain cells can die. That is how important time is. Therefore, we say time is brain. We say golden hour, but now we don't talk about hour. We talk about platinum seconds. That is how important it is that we do things in time and save time, because minutes can save lives, seconds can save lives, and that's why it is very important to spread this awareness that anybody with even a suspicion of a stroke has to go to a proper stroke center or a stroke enabled hospital which has all the types of treatment for stroke. Otherwise patients will be having to go from one place to another. We are very happy to say that in the 1 year that we are here in this new hospital, we have treated over 150 strokes, and in the 10 months or so, thank you. And more importantly, in the 10 months or so that we have actually done work, we have received the Gold Status Award from the World Stroke Organization. That only shows that with increasing awareness, with an integrated stroke care, we can help people recover, we can save lives, we can reduce their disability. Now, we are talking about integrated stroke care. So what does that mean? What it means is it is not just one department which is working. It does not mean that it is one doctor which is working, but it is a team of doctors, a team of departments which work. And that is what gives the best of patient outcomes. If you look at here, from the ambulance service to the emergency room, to the neurocritical care specialist, to the neuroradiology where CT/MR is done, to the neurologist who can give drugs, to the endovascular intervention specialist who can do procedures in the cath lab, to neurosurgery, and finally, last but not the least, to neurorehabilitation. Everybody has to come together and deliver the best to the patient. If you do that, then you can reduce disability, save lives, and remember, we can even reverse a stroke. We can even reverse a stroke. But for this, patients have to reach early to a stroke-enabled center, to a center where all this is available properly. If that happens, then the patient's chance of becoming normal again is the best chance. And that is what I said in the beginning, I'm going to give the press something to do. I want you to spread this awareness that there is a chance now in Chennai. You don't have to go outside, you don't have to go abroad. This question of going abroad is all now gone. In Chennai, it is possible to do it. And here we are going to launch, and we are doing the work like this as an integrated stroke service. And at this point of time, I think I would like to recognize and felicitate some of our patients who have put their trust in us, so that we have been able to show that good stroke work gives good results. So, could I call on our MC to call on the patient?